With Chapter 15, we will begin the segment of the course which we refer to as Nutrition through the Life Cycle. One of several ways to ensure optimal growth, maintenance, and health of our bodies, as we have seen, is through proper nutrition. Normally, we think of nutrition as being personal, affecting us alone, and it is, for most of us, throughout our lifespan. However, for the woman who is pregnant or who soon will be, nutritional choices can profoundly affect the health of her developing child. The nutrient demands of pregnancy can be termed as being extraordinary. Before we actually examine these nutritional demands, there are a few notes on preparing for a healthy pregnancy. While an adequate and balanced diet is obviously necessary during pregnancy, the choices that are made prior to pregnancy are also very important. Fertility and sound nutrition are directly linked. In fact, it has been shown that a woman who is properly nourished has an increased chance of fertility. It is important not only for women, but also for men. Men who are consuming diets that are rich in antioxidants and low in saturated fat have been shown to have higher sperm counts as well as increased sperm motility. Alcohol also can have an effect. It has been shown to alter sperm's genetic material, or DNA. So healthy habits adopted by not only females, but as far as males go, is also important. Other things to focus on as far as preparing for a healthy pregnancy are achieving and maintaining a healthy body weight, being physically active, receiving regular medical care, such as prenatal care. Managing chronic conditions is also very important. If a woman is diabetic or has hypertension, these need to be well controlled during the pregnancy months. Then lastly, we'll take a look at harmful influences, which also can have an effect on the developing fetus. Before we look at specific nutritional needs, let's first focus on the growth and development that occurs during pregnancy, which specifically involves three structures. These structures are critical for fetal development, and the first one to note is the placenta. The development of the placenta takes place within the uterus, and it's referred to as being a muscular and metabolically active organ. Maternal and fetal blood can circulate, and there can be an exchange of nutrients as well as waste products. Oxygen and nutrients can be passed to the fetus, whereas carbon dioxide and other waste products can be passed to the mother for excretion. The placenta is also the principal site of hormone production. These hormones are necessary to maintain the pregnancy itself, as well as preparing for lactation after delivery. The second structure that develops is the amniotic sac. This is a protective fluid-filled sac in which the fetus floats while it is in utero. The third structure that develops is the umbilical cord. It has the capability of allowing the veins and arteries of the fetus to reach the placenta to obtain the nourishment that it needs from the mother, as well as being able to pass waste products to the mother for disposal. Here you can see the developing fetus as well as the three structures just noted. The interaction which allows for nourishment going to the fetus as well as the waste products being sent back to the mother are apparent. The fetal veins and arteries extend into the pool of maternal blood, which is where the exchange of these nutrients and waste products take place. Fetal development begins with the fertilization of an ovum by sperm. The first stage involves the development of what's known as a zygote, which is implanted into the uterine wall. The second stage after implantation is when the placenta starts to develop. This now allows nourishment to be provided to the developing embryo. The next stage, which is the development of the fetus itself, occurs after 11 weeks gestation. The final stage, which typically is after 9 months, is the delivery then of the newborn infant. During these periods of embryonic and fetal development, each organ and tissue type grows with its own characteristic pattern as well as timing. The development of each takes place only at a certain time, which is considered to be the critical period, meaning that there are certain cellular activities that only occur during those specific times. If cell division or cell number are limited during these critical periods, full recovery is thought to be highly unlikely, and there can be permanent damage that occurs for the developing embryo or fetus. You can see how early in gestation some of these critical periods actually occur. Nutrient deficiencies, excesses, toxin exposure, as well as other conditions can negatively affect critical development. One particular nutrient we're going to take a closer look at is the relationship with folate and how it is necessary during the development of the central nervous system. The next slide depicts these critical periods in graph form, so you may want to take a few moments to look at that particular visual. It is estimated that approximately 3,000 pregnancies per year are affected by what is known as a neural tube defect. The neural tube is a structure that eventually develops into the brain and the spinal cord. What happens with a neural tube defect is that there are malformations which occur within the brain itself, the spinal cord, or in some cases both of these areas during embryonic development. If you look back at the graph on the previous slide, you'll note that central nervous system development occurs during 2 to 5.5 weeks gestation. If there's anything that goes wrong during that period of development, it can result in a child being born with a neural tube defect. Two specific conditions include, first of all, anencephaly. This occurs when the upper end of the neural tube fails to close or fuse together. The brain may be missing or it just fails to develop appropriately. Another condition is known as spina bifida. This occurs when there is an incomplete closure of the spinal cord as well as the bony encasement which should be enclosing it. The meninges membranes covering the spinal cord often then can protrude outside of the spinal cord itself. It can rupture and lead to meningitis. Other occurrences with a child who is born with a neural tube defect can include dislocated hip, curvature of the spine, development of a club foot, muscle weakness, kidney disorders, mental impairment, as well as motor and sensory issues. Take a look at this slide and you'll see on the left-hand side a normal developing embryo at 4 weeks. At the top of the embryo, you can see that there is a V-shaped notch. This is the neural tube which has yet to close. This is completely normal at this stage. At 6 weeks, however, on the right-hand side, you can see where this embryo's notch has now closed. The neural tube is now enclosed and proper development is proceeding. If that neural tube does not close, if that notch remains open, the result most likely would be a child born with a neural tube defect. Here we see a depiction of a child born with spina bifida. There is an issue with the bony encasement not developing appropriately to keep the spinal cord intact, so it protrudes often as a sac. The potential to rupture is high, as previously noted, leading to meningitis. The other results, which also were previously noted, included then the development of a dislocated hip, curvature of the spine, etc. There are factors that have been identified that can increase the occurrence of a neural tube defect. First of all, if mom has had a previous pregnancy which resulted in a child being born with one of these defects, there is an increased risk. If there is a family history, if there is a history of maternal diabetes or gestational diabetes, maternal Hispanic ethnicity increases the risk. Maternal use of anti-seizure medications, maternal obesity, all can increase the risk of a neural tube defect. In addition, a major relationship has been found with inadequate folate intake and an increased risk of a neural tube defect. Adequate amounts of folate directly reduce the risk of a neural tube defect. It is recommended that folate supplementation be taken prior to conception if a female is trying to become pregnant, and then it should be continued throughout the first trimester. This coincides with the critical period of development of the central nervous system, which occurs during 2 to 5.5 weeks gestation. The RDA set for pregnancy for folate is 600 micrograms per day, which is above the normal RDA of 400 micrograms per day. Foods that can help ensure adequate amounts of folate include fortified grains, leafy green vegetables such as spinach, kale, collard greens. Legumes, the dried peas or dried beans, are another good source. Seeds such as pumpkin seeds, chia seeds, hemp seeds, or sesame seeds also provide folate, as well as liver. If one is taking the typical recommended prenatal supplement, folate will be included as part of that formulation. If a mother has previously given birth to a child who has had a neural tube defect, often she may be given a high-dose folate supplement, and it may go up as high as 4 milligrams per day. Next, we'll take a look at other physiological changes that occur during pregnancy. There are changes in blood volume as well as blood composition. Blood volume expands by about 50%. Because of that increase, there is actually a dilutional effect that occurs with red blood cells. Anemia can be one of the potential side effects. There may be an increase in extracellular water accumulation, which can frequently lead to edema. Swelling commonly occurs in the peripheral areas of the body, especially in the hands and the feet during pregnancy. Increases in triglyceride levels, cholesterol levels, as well as free fatty acid levels are common. Usually these return to normal after delivery. Changes also occur in the GI tract. It's often thought to be directly related to the hormones of pregnancy, or more specifically, progesterone. Progesterone causes relaxation of smooth muscle. Our entire GI tract is lined with smooth muscle, so often hypomotility can result, leading to constipation. There can also be relaxation of the smooth muscle around the esophageal sphincter, which can cause heartburn, another common effect of pregnancy. It's also thought that nausea and vomiting, which can also be common, may be related to hormonal changes, or once again, more specifically, the increased amount of progesterone. Cardiac and pulmonary changes also occur during pregnancy. There is an increase in cardiac output as well as an increase in pulse rate. Very commonly, there may be an increase in blood pressure. However, this usually returns to normal by the third trimester. There is a decreased threshold for carbon dioxide, which can then result in shortness of breath. Renal changes may also occur. There is that increased blood volume, which is a result of pregnancy. which then causes an increased rate at which filtrate travels through the capillaries of the kidneys. The result is increased urination. Increased urination also occurs because of the developing fetus putting pressure on the bladder itself. Because of the great increase that I noted in filtrate going through the kidneys are not quite as efficient, and often they are unable to reabsorb certain nutrients. So it's not uncommon to see a larger amount of glucose, some water-soluble vitamins, as well as amino acids showing up in the urine. How do these physiological changes, as well as the developing fetus, impact the energy and nutrient needs of pregnancy? Women's nutrient needs may increase more for certain nutrients than for others, and ideally one wants to make the appropriate food choices. After the first trimester, energy needs or caloric needs increase. An additional 340 calories per day is recommended during the second trimester, and an extra 450 calories per day is recommended during the third trimester. Most well-nourished pregnant women can meet these demands by selecting appropriate nutrient-rich and calorically dense foods. Selecting the appropriate foods from the 5 food groups which have been identified in the dietary guidelines can work quite well for planning out an appropriate diet during pregnancy. Adequate carbohydrate intake is very important. Carbohydrate is necessary to provide fuel for the developing fetal brain. It also avoids breakdown of the mother's protein stores. What is recommended is at least 175 grams of carbs per day, not going below 135 grams per day. The selection of foods such as whole grain bread, cereals, dark greens, and other vegetables, legumes, and fruits can provide not only adequate amounts of carbohydrate, but other nutrients as well. They can also provide phytochemicals, which are important components in a healthy diet. As far as protein, the recommendation is an additional 25 grams per day. Ideally, the protein should come from food sources as opposed to protein supplements, mostly again due to the fact that food is going to have other nutrients present besides just the protein. Protein is extremely important not only to sustain the growth of the placenta and developing fetal tissue, but also to maintain maternal tissue as well. The high nutrient requirements during pregnancy actually leave very little room for excess fat, especially saturated fat and trans fat. Essential fatty acids are extremely important to the growth and development of the fetal brain. The brain is made up predominantly of lipid material and depends very heavily on long-chain omega-3 fatty acids as well as omega-6s. Sources of omega-3s include fatty fish, flaxseed, walnuts, canola oil, as some examples. Omega-6s are found predominantly in vegetable oils, so consider canola oil, corn oil, safflower oil, and all of those can contribute those specific fatty acids. The B vitamins are extremely important for blood production as well as overall cell growth. Thiamine, riboflavin, and niacin are critical for energy metabolism. B6 is important because of an increased need for protein metabolism and protein synthesis. Folate, as already mentioned, has that very important role in decreasing the incidence of neural tube defects. B12 is also critical because it's necessary to be able to convert folate to its active form. So again, it can play its role in preventing neural tube defects. There are also the important nutrients necessary for bone development as well as mineralization of teeth. These include vitamin D, calcium, phosphorus, and magnesium. The trace mineral iron also is extremely important. Iron is necessary to meet the increased needs of blood volume and the demands of the placenta as well as the fetus. Iron is considered to be the nutrient which is most difficult to ensure adequacy of during pregnancy. For that reason, iron supplementation is often common during the pregnancy months. Zinc is another nutrient which is vital. It has a direct role in protein synthesis as well as overall cell development. From these graphs, you can see the comparison of nutrient recommendations of non-pregnancy compared to pregnancy compared to lactation. Some of these nutrients obviously need to be increased during pregnancy, as well as necessary increases to sustain lactation or breastfeeding. Especially note the increased need for many of the B vitamins as well as certain minerals. The recommendation for a healthy amount of weight gain during pregnancy depends on what one's BMI is prior to pregnancy. If the BMI is determined to be below 18.5, which would be a category of being underweight, the recommendation is to gain anywhere from about 28 to 40 pounds. If BMI is between 18.5 to 24.9, this is considered a healthy weight, and the recommendation is a gain of 25 to 35 pounds. With a BMI of 24.9 to 29.9, classification of being overweight, recommended weight gain would be 15 to 25 pounds. If the BMI is greater than 30, this would be the classification of being obese, and the recommendation is between 11 to 20 pounds weight gain. Typically, there is about a 3.5 pound to 4 pound weight gain for the entire first trimester, and then after, it's usually about 1 pound per week. If we look at the distribution of this weight gain, we can see that it's found in various areas of the pregnant woman's body. There is an increase in breast size, which can add on about 2 additional pounds. The increase in fluid volume adds about 4 pounds. The placenta, on average, can weigh about 1.5 pounds. The increase in the blood supply to the placenta adds on about 4 pounds. Amniotic fluid contributes 2 pounds. The average size of an infant at birth is about 7.5 pounds. And then there's still another additional 2 pounds, which comes from the increase in the size of the uterus, as well as the muscles which support it. During pregnancy, the mother tends to lie down additional fat stores, which is the body's anticipation of lactation, and that can add on up to about 7 pounds. An active, physically fit woman who is experiencing a normal, healthy pregnancy should be able to continue to exercise throughout the pregnancy. She'll want to adjust the intensity and the duration, though, as the pregnancy progresses. By staying active, it can not only improve the fitness of the mother-to-be, but it can also play a role in helping to facilitate labor. It can help to manage or prevent gestational diabetes, and it can reduce stress. Active women have been shown to report fewer discomforts throughout their pregnancy, and they also have the benefit of retaining those healthy habits that can help to lose excess weight after delivery. Choosing low-impact types of activities are recommended, avoiding anything that would result in high elevations in body temperature or potential dehydration, because these can be issues that can directly harm fetal development. There are some common nutrition-related concerns that may arise during pregnancy. One to note is nausea. Nausea often occurs during pregnancy, and sometimes women will refer to it as morning sickness. However, for some, it can occur anytime during the day. It can be extreme in some cases, often coupled with severe vomiting. Whether it is early on or throughout the pregnancy, this may be a concern because it can result in changes in acid-base balance, leading to acidosis. It can also lead to dehydration and weight loss. It's thought that potentially there may be a relationship with nausea and the increase in the hormones which are being produced during pregnancy. Some of the common alleviation strategies to note include eating dry foods such as toast or crackers, consuming small frequent meals, avoiding high fat and spicy foods, chewing gum or sucking on hard candy, as well as avoiding offensive foods and odors. Some smells not only of food, but things like perfumes, cleaners, etc. can also initiate a nauseous response. Constipation is another condition which can be common during pregnancy. Progesterone, the pregnancy hormone that I previously mentioned, alters smooth muscle. Because of that, it can cause hypomotility, especially through the lower GI tract. Then there's also pressure from the fetus on the GI system itself. These combined often with iron supplementation can increase the risk of constipation for some women. Some of the typical alleviation strategies are incorporating high fiber foods, which in turn can help to increase motility through the GI tract, incorporating exercise, making sure that one is consuming adequate amounts of fluid can also help. In severe cases, laxative use may be recommended by the physician. Heartburn is another common occurrence during pregnancy, and once again this goes back to hormones, or specifically progesterone. Progesterone, as it relaxes the smooth muscle, it also relaxes the esophageal sphincter, allowing for heartburn to occur. Alleviation strategies include eating small frequent meals, remaining upright while eating, elevating the head of the bed while sleeping, taking your time and eating slowly, drinking liquids or fluids between meals, and the avoidance of spicy or fatty foods as well. Reducing the intake of caffeine and carbonated beverages is also suggested. These have been found to relax the esophageal sphincter even further, therefore increasing the potential for heartburn even more. There are certain conditions which can place a mother-to-be in the category of what is known as a high-risk pregnancy. These types of pregnancies include risk factors that increase the likelihood that there will be a premature delivery, a difficult birth, restricted overall growth, birth defects, and early infant death. Proper nutrition obviously does come into play to affect the progression of pregnancy, but then also avoiding certain substances such as alcohol, drugs, smoking can have an impact on the outcome of the pregnancy itself. Routine prenatal care is also considered to be critical. A high-risk pregnancy is most likely to produce what is known as a low birth weight infant. A low birth weight infant is defined as being born at 5.5 pounds or less, but they're born full term, which means that they have reached between 38 and 42 weeks gestation. These low birth weight infants are associated with many risks, which include complications during delivery, increased risk of birth defects, suppressed immune function, as well as an overall higher mortality rate. Low birth weight infants often are a result to some type of growth failure that happened in utero. Maybe it's due to malnutrition, maybe it's due to exposure to some type of toxic substance. These children usually have a decreased likelihood of experiencing what's known as catch-up growth. There may be cognitive implications, and they have a much lower chance of becoming fully developed as they get older. A low birth weight infant is different than a premature infant, or what we refer to as a preemie. Preterm infants are born before they are fully developed. They are often underweight and they may have trouble breathing because their lungs are immature. Yes, they are extremely small, but they're appropriate for their age. If you have a preemie who was born at 26 weeks, yes, again, they're going to be extremely small and underdeveloped, but they are the appropriate size and at the appropriate developmental stage for an infant who is 26 weeks gestation. These preemies actually have a better chance of being able to experience that catch-up growth, achieving proper development as they get older. Let's take a look at some of these high-risk pregnancy factors which can have an effect on a healthy pregnancy. Previously, I had noted that malnutrition may affect fertility and therefore interfere with the ability to conceive. During pregnancy, malnutrition also will have effects. It can result in overall impaired fetal development. There may be malformations. There can be an increased risk for miscarriage and stillbirths. It can also impact the weight of the developing fetus itself, resulting therefore in a premature birth or delivering a child who has a low birth weight. Another high-risk pregnancy condition is pre-existing diabetes. So this is the mother-to-be who has diabetes prior to pregnancy. As long as her glucose levels are controlled, she will most likely deliver an infant of a healthy weight and at an appropriate developmental stage. However, if glucose levels are high and uncontrolled, the result may be the delivery of a very large baby. The excess amount of glucose in the bloodstream gets passed to the developing fetus, causing a tremendous increase in growth. Other possible results can include labor complications, birth defects, organ damage, premature delivery, or miscarriages. There's also risks to the mother if her blood glucose remains uncontrolled. Diabetic ketoacidosis can occur, which can alter pH levels dramatically. Also, the eyes and nerves can be damaged from continued elevation in blood glucose levels. Gestational diabetes is another high-risk pregnancy condition. This type of diabetes develops only during gestation, so if a mom is receiving prenatal care, she will be tested for it. She will have what is known as a glucose tolerance test done, usually at about 24 to 28 weeks. If her glucose levels are high, the appropriate steps can be taken to help control them. One possible connection with developing gestational diabetes is once again with those placental hormones. Progesterone in particular may interfere with the use of one's own insulin levels, interfering with them being efficient. The result then would be elevation in blood glucose. There are certain factors which increase the likelihood of developing gestational diabetes. Age is a factor. As age increases, the risk increases. One's BMI comes into play. If the BMI is greater than 25 or a woman has experienced excessive weight gain during pregnancy itself, it increases the risk of gestational diabetes. If there have been complications in previous pregnancies, if there is a family history of type 2 diabetes, these also increase the risk. Women from certain races are also more likely to develop gestational diabetes. Consequences of gestational diabetes, if uncontrolled, are going to be the same as for the woman who has uncontrolled pre-existing diabetes. Complications during labor and delivery, the birth of a high weighing infant, as well as organ damage to both the mom as well as the infant itself. Pre-existing or chronic hypertension is a risk to a healthy pregnancy. For the mother-to-be, complications can include edema, even the occurrence of heart attack as well as stroke. With uncontrolled blood pressure, the placenta can actually separate from the wall of the uterus, which in turn can have dramatic effects on gestation. The delivery of a low birth weight infant or premature infant can occur, as well as miscarriages or stillbirths. Treatment typically will involve using proper medication, adequate nutrition, as well as weight control. Pre-eclampsia and eclampsia are conditions which also fall under the category of a high-risk pregnancy. This is a condition which develops usually after about 20 weeks gestation. The symptoms of pre-eclampsia include high blood pressure, the presence of protein in the urine, sudden weight gain, whole body edema. There may also be headaches which may result, as well as blurred vision. There will be a decreased amount of blood flowing to the fetus, which then can result in decreased overall growth. If preeclampsia progresses to what's known as eclampsia or toxemia, the results can be significant. What can occur here is seizures, as well as coma, and potentially even leading to maternal or fetal death. The treatment is extremely important. It will focus on controlling blood pressure as well as preventing seizures. Medical monitoring is imperative throughout this whole period of time. Maternal age also has an effect on pregnancy progression, and two high-risk periods are adolescence and greater than 35 years of age. During adolescence, the teenager's body is still developing, so there can actually be competition between maternal and fetal needs. Iron deficiency anemia is very common in this population, and dietary intake often is of low nutrient content. There has been shown to be a higher rate of stillbirths, preterm births, as well as a low birth weight infant. This population is also the least likely to seek prenatal care. After the age of 35, there also is an increased risk. Typically, there is a higher likelihood of having a preterm child delivered as well as a low birth weight infant. There is also an increased risk of Down syndrome when the age is greater than 35 years. We're now going to take a look at what we would consider to be harmful practices during pregnancy. The first to note is alcohol consumption. Consumption of alcohol during pregnancy can result in the birth of an infant with what's known as fetal alcohol syndrome. The alcohol, if it's being consumed, crosses the placenta, and it can directly deprive the fetus of nutrients and oxygen. It can interfere with cell development, tissue development that is occurring especially during those critical periods of development. Other manifestations can include poor motor skills, cognitive issues, hyperactivity. There can be physical manifestations, abnormalities of the face as well as the skull, birth defects which can result in cleft palate, heart issues, genital development, as well as urinary issues. Take a look at the upcoming slide and for a few minutes review the visual depiction of a child with fetal alcohol syndrome. How does the damage occur in relation to alcohol and pregnancy? Well, during the first trimester, placental development continues, and without the placenta acting as a buffer, alcohol diffuses directly to the developing cells and tissues. During the first trimester, alcohol ingestion will alter brain, heart, and kidney formation. During the second trimester, alcohol greatly increases the risk of miscarriages. Then, during the third trimester, continued alcohol use increases the impairment of both body systems and the brain. Another note is the influence of the father. It was noted previously that high amounts of alcohol can alter sperm development. What can happen is if a father has been consuming large amounts of alcohol and sperm has been altered, now this altered sperm is what's combining with an egg and fertilizing it, therefore increasing the risk of fetal development being affected. As far as how much alcohol is considered to be too much, well, studies show that even 1 drink a day can affect overall neurological development. Because of these findings, health professionals recommend that alcohol is completely avoided during pregnancy. Medicinal or over-the-counter medications can also cause complications during pregnancy. The ingestion of aspirin or ibuprofen, which would include Motrin or Advil, can affect fetal circulation. They can induce premature uterine contractions and increase the risk of an iron deficiency. Usually during pregnancy, if a woman needs a pain reliever, what is recommended is acetaminophen or Tylenol. Cough and cold medications may also be an issue. Some of them may include alcohol as one of their ingredients, so it's always a good idea to check the ingredient list. General recommendation, however, is to always check with a physician prior to taking any over-the-counter medication during pregnancy. Recreational drugs, illicit drugs, can have an impact during pregnancy. These can cross the placenta and cause detrimental complications. They can result in the birth of a low birth weight infant. They can also induce premature birth as well as birth defects. Miscarriages can also result. In other cases, the infant can be born addicted to whatever the drug may be, and then they themselves need to go through the severe withdrawal symptoms. Smoking or the use of tobacco also needs to be avoided during pregnancy. These can decrease oxygen supply to the fetus, as well as decreasing overall blood supply. Complications can include low birth weight infants, nervous system impairment, separation of the placenta from the uterine wall, miscarriages, cardiac and respiratory issues, as well as SIDS, or what's referred to as sudden infant death syndrome. Then considering the use of supplements. Taking a prenatal vitamin or prenatal supplement is usually routine during pregnancy. However, a woman does not want to go over and above what she's getting through that prenatal supplement unless it is specifically prescribed. If she is taking in excess amounts of certain nutrients, the results can be detrimental. Excess amounts of vitamin D during pregnancy can cause abnormalities in the fetal cardiovascular system. Excess amounts of vitamin A can cause severe malformation of the cranial nerve system. Another practice to consider is the ingestion of caffeine. Caffeine is a central nervous system stimulant, and it's been shown that it can enter into the fetal bloodstream. The fetus, however, finds it very, very difficult to be able to metabolize this stimulant. It's been shown that moderate to heavy use of caffeine may potentially induce premature contractions. General recommendation then is that during pregnancy, a woman should limit their caffeine intake to no more than 2 caffeine-containing beverages per day. Another practice to consider is dieting. Restrictive dieting is considered to be hazardous during pregnancy. This certainly is not a time during the lifespan that a woman should be trying to lose weight. What can occur, especially if she is restricting carbohydrate intake, is that the fetal brain is deprived of glucose. And glucose is especially important for proper brain development. Other nutrient recommendations, if they are not met, can also result in compromising overall fetal growth and development. We first discussed sugar substitutes back in Chapter 4. So can these fit in during pregnancy? Sugar substitutes include things like sweet and low, aspartame, equal, Splenda, sucralose, among others. For the most part, these are considered to be acceptable as long as they are not ingested in large amounts. They are actually approved by the FDA. However, if a woman who is pregnant does have a condition which is known as PKU, phenylketonuria, she needs to completely avoid the use of Equal or NutraSweet because that can have some detrimental effects on the fetal development. Environmental contaminants can also cause issues during pregnancy. If a woman comes in contact with lead, that can have a direct effect on the development of the nervous system of the fetus. Mercury can also harm the brain and nervous system. Generally, fish tend to be the food highest in mercury content, and the ones that should be avoided include shark, swordfish, king mackerel, and tilefish, as well as big-eye tuna. There should be a limitation on the average weekly consumption of seafood, and that is 12 ounces per day. If one is consuming tuna, the recommendation is no more than 6 ounces cooked, or if one is ingesting albacore tuna, that needs to be limited. The chunk light tuna, which also comes in a can, tends to be lower in mercury content, so it doesn't have the same types of risks associated with it. Foodborne illnesses may cause issues during pregnancy. Certain microbes can cause not only GI distress, such as nausea, vomiting, and diarrhea, but also meningitis, pneumonia, and in some extreme cases, even fetal death. Women who are pregnant are 20 times more likely to get a condition which is known as Listeriosis. This is an infection caused by eating food contaminated with a microbe known as Listeria. The foods that tend to harbor this type of microorganism include meat, poultry, eggs, and seafood. So the recommendation is that these foods should be thoroughly cooked. Soft cheeses such as feta, brie, camembert, or roquefort can also harbor not only this particular microorganism, but others, so they should be avoided. Unpasteurized milk, unpasteurized juice should also be avoided because they tend to have a higher concentration, again, of microbes, which can lead to adverse effects. Just as nutrition is important to assure a healthy pregnancy, it is also important for the mother who breastfeeds. The Academy of Pediatrics recommends breastfeeding for at least 4 to 6 months if possible. In some cases, that might not work out, and there are appropriate formulas which are comparable in nutritional content. And we'll take a more detailed look at both breastfeeding and formula feeding in Chapter 16. Nutrient, energy, and fluid needs tend to be high during lactation, and also some of the substances we consider to be harmful during pregnancy will also be looked at once again. Alcohols, other drugs, smoking, they can reduce overall milk production as well as enter into the breast milk and be passed to the baby, impairing growth and development. During lactation, a mother produces approximately 25 ounces of breast milk per day with considerable individual variations. To produce an adequate supply, a woman needs an additional 500 calories per day. To meet this need, she can consume about 300 to 330 calories extra and then rely on the remaining amounts coming from the additional fat stores that she accumulated during pregnancy. In turn, this will help with weight loss. In general, most women need a minimum of 1,800 calories a day to ensure all the necessary nutrients for lactation. Protein and fat needs remain the same as during pregnancy, but carbohydrate needs increase to replace the glucose being used to make the lactose in breast milk. While weight loss is often a focus after delivery, many women will resume an exercise pattern. One note, however, is that intense physical activity may increase lactic acid in breast milk, which may alter the taste, thus affecting the infant's desire to nurse. Studies have shown that infants actually prefer pre-exercise breast milk. As far as vitamins and minerals, there remains an increased need for most of the ones which are increased during pregnancy. Calcium also needs to be continued to be consumed in appropriate amounts to help maintain the overall bone density of the lactating mother. More fluid or water doesn't produce more breast milk, but it is necessary to avoid dehydration in lactating women. Recommendation includes consuming 3.1 liters, which is about 12 cups per day of fluid. Generally, if a mom makes a point of drinking 8 ounces of fluid prior to breastfeeding and then another 8 ounces after breastfeeding, it will help to ensure she's getting adequate hydration. It's often recommended that during lactation that the mother continues to take her prenatal vitamin. This, coupled with consuming a balanced diet, will ensure all the necessary nutrients. As with pregnancy, there are harmful practices or substances to avoid during lactation. Once again, alcohol. Alcohol will enter breast milk and will peak usually about an hour after ingestion. Breast milk consumption by the infant may then decrease even with just a small amount of alcohol being consumed by the mother. It's been shown to alter taste and suppress appetite. Alcohol can also reduce overall milk production. Caffeine, another substance to be addressed. Caffeine, being a central nervous system stimulant, can enter breast milk. It can cause irritability in infants as well as sleeplessness and interfere with iron absorption. The recommendation is for moderate consumption of about 1 to 2 caffeine-containing beverages per day for the lactating mother. Smoking also needs to be avoided during lactation. It can decrease weight gain by the infant, and it can increase the risk of sudden infant death syndrome, or SIDS. Smoking also can reduce overall milk production, and it can change the flavor as well as the smell of the breast milk itself. Recreational drugs or illicit drugs need to be avoided. They will be transferred through the breast milk to the infant feeding, resulting in irritability, tremors, hallucinations, can lead to addiction. It can also lead to infant death. Medicinal drugs can also pass through breast milk, and the same recommendation applies as with pregnancy. Mom should always check with her doctor before taking any type of over-the-counter or medicinal drug.